Good morning. We are so glad you decided to join us today. Let's see, we'll wait a couple of minutes, a couple of seconds to let people get connected to audio, to get comfortable in their own seats. Everybody's ready to roll. All right. Good morning, everyone. Welcome to this wonderful presentation I'm super excited about. It's Future Forecast. And we are very lucky today to have Megan and Sarah join us to talk all about Montana 21C. And with that, I will pass it over to you.
Fantastic. Thanks, Desiree, and thanks everyone for joining. I'm Megan Gillespie. I work for the Montana Department of Health and Human Services in the Public Health System Improvement Office. And I'm proud to be part of the 21C effort. Both Sarah and I are joining you from Glasgow, Montana today, and so hopefully we'll be able to stay connected to the internet for the whole time. With that, I'll let Sarah introduce herself.
Hi, good morning, everyone. Excuse me. I'm Sarah Compton, and I'm a program officer with the Montana Public Health Institute. Really excited to be sharing some of this work today and what is 21C and where we're going with it.
Great. So before we dive into the actual content, we want to provide just an overview of the goals and objectives for today. The biggest thing that we want you all to know from our presentation today is we want this to be interactive. We want to hear from you. We want to know what your questions are. And so as we're going through this, feel free to come off of mute or type questions into the chat. This is really an opportunity for you to be heard and also to ask questions or concerns as we go through our 21C content. Our first goal of today is to really understand the foundations of public health services in Montana. So you'll be able to see the Foundational Public Health Services Framework. We call this FPHS. If you're familiar with public health, you know there is more acronyms than we know what to do with. And so we're going to add another one to your vocabulary today. In addition, we're going to really overview how the FPHS assessment is in alignment with the larger Montana 21C effort and how that data is being utilized. Our second goal is to really analyze the impact of the Montana 21C initiative, getting into how this will impact you at a local and tribal level, how it will impact you at a regional level, and how it will impact our system statewide. As we know, we're stronger together, and that's really the core of this initiative. And so with this, you'll be able to understand how this all came about, where we're at now, and where we're going. And with that, I'll turn it over to Sarah to talk about what is Montana 21C Strengthening Public Health Together.
Awesome. Thank you, Megan. Well, can you go back just one? I just have a quick little blip about what is Montana 21C. So I'm really excited to talk about this. As Megan mentioned, we're on the road right now. Talking about it. So we've been talking about it all week. I'm happy to talk to a different audience today about it. But I also wanted to provide you just to start about like, well, first of all, what is Montana 21C? And this is a new initiative that we are working on to improve Montana's public health system. And that seems like a very broad and lofty goal, but we are really excited about this initiative specifically because it is like really focuses on the system partners and collaborating across the system, good communication, increased training, and ideally what 21C is one of our long-term goals is to potentially identify new funding sources to meet the needs of the Montana's public health system. This is a statewide partnership between local and tribal health departments and many, many partner organizations. Next slide, please, Megan. So what you see here is a map of the states that are currently part of the 21C initiative. This is a national program that is really housed under the umbrella of the Public Health Accreditation Board. So FAB, as you all are maybe aware, is the entity that is running public health accreditation. So really, looking at the local and the state public health departments and systems. 21C looks a little bit broader and looks at the whole state. And so what FAB has really, I think, done a really good job of digging into is really understanding that public health transformation cannot happen in isolation, that innovation, collaboration, and shared learning are really essential to drive the change that we need to meet our current and future public health needs. The 21st Century Learning Community is what 21C stands for, and it's a group of states that are focused on intentional statewide public health systems transformation. This initiative started with 3 states back in the 2010s, I believe, and has grown to just happens to be a happy coincidence. There are currently 21 states enrolled in the 21C program. So that is hopefully we'll see an increase in that in the next year or so. But this work is really grounded in the foundational public health services that we're going to discuss a little bit later. As Megan mentioned, we're going to add another acronym to your alphabet soup buckets. But many states have success stories about using the work that really is part of this 21C initiative to leverage additional funding to provide those foundational public health services to their state populations. Excuse me. Montana was granted membership to 21C in the summer of last year in 2024. And Megan was part of the cohort that went to a national meeting a convening of all of the 21C states. So one of the really great things about this effort is that we're learning from other states who have already gone through this process. We're learning about successes, we're learning about strategies, and we understand that each state looks very different based on its demographics, its geographies, political climate, all kinds of variables. And so the effort really that surrounds the 21C, I would say philosophy, is that each state really gets to be determine what transformation looks like specifically for those states. And the foundational public health services, as we talked about, is like part of that piece. And we get to really look at Montana solutions for Montana problems. So yeah, looking at ways that we can be responsive specifically to those Montana needs. Next slide, please, Megan. This one is hot off the press, guys. This just like came out in an email from the 21C folks at FAB, like yesterday, I think, like yesterday morning, I think we got it, or late Monday. I don't even know what day it is anymore, but like this is our new framework for 21C transformation. So this there's plenty of cycles in the public health world. A lot of the work that we do is cyclical, and this is no exception. So you can see here that really, I think where we are right now is getting it organized and still assessing the system. A lot of that work was done last year with the foundational public health services assessment piece, going into design and innovation about what our approach looks like for this transformation efforts, testing and transforming, and then evaluating the system. So this, again, looks very similar to a lot of the models around quality improvement and process improvement. And you can see at the bottom of this slide here is the cross-cutting concepts that we're really working to address within this work. So public health services framework, governance, how we're delivering our public health services, human and financial resources, policy and legislation, standards and performance measures, and then responsibility and accountability. So these are all like really big pieces, and we're making sure that we're doing this together so that hopefully nobody feels isolated tackling what are pretty sizable issues. Next slide, please. So sorry, I'm working on one screen today. This slide illustrates what we're calling, I believe, our like founding 21C partners. We are currently engaged in adding additional partners to our initiative and to this work. So just sort of highlighting some of our big partners here. We're on the call here today with the Montana Public Health Training Center, the University of Montana, really, helping us spread our message far and wide and focusing on training needs throughout the state. The Montana Healthcare Foundation has been a very, I would say, vocal and sustaining supporter of this work for many years. I work for the Montana Public Institute, Megan with DPHHS and the System Improvement Office and other bureaus within that organization. We also are working with the Office of American Indian Health because the tribal partners are a big part of this work as well, and ensuring that we have, government to government communications. And then Confluence as the umbrella organization over MPHA, AMFO, and the Montana Environmental Health Association. So what you don't see here are individual logos from each of the local and tribal health departments, and you guys are our key stakeholders for this work. We welcome, as we continue to welcome more partners, we understand that public health touches many, if not all, aspects of our lives. So I wanted to give just a little bit of this is sort of like our high level of Montana 21C. I want to give a little bit more of a timeline on sort of where we are to date. And in sort of convening this group and working through this process of establishing this collaborative network and getting to this brand that you see on the slides here. So I mentioned that there was a convening last year after Montana was granted access to or entry into the 21C national collaborative. We had a meeting in December of 2024 to really start to pull these initial partners together to really start to talk about what does this mean for Montana? Here's this framework, here's these supports that we have, here's this data that we've collected from all of our local and tribal jurisdictions. What are we going to do with it? And what are our sort of goals and our next steps? Part of that, one of the things that came out of that was that we really wanted to make sure that people knew about 21C. This is part of that effort. But in the December meeting, we determined that Confluence Spring Conference would be a great time to really launch this effort. So if any of you were at Confluence last month, you hopefully heard about this in the keynote on the first day of the conference. And there was a lot of work that led up to making sure that happened. And it's always impressive to me, like the amount of work that goes into being really thoughtful and intentional about how we're moving forward with this work and letting people know what we're doing and being organized around it. So that December meeting, we had formed quite a few subgroups. I feel like Megan and I's life was revolved around like different 21C meetings for a really long time. There was a data meeting, there was a Confluence keynote meeting, there was a communications and branding meeting, there was a small like sort of core steering committee meetings. And then also the workforce assessment group has come under 21C that's assessing the Montana public health workforce. And we're also in the process of developing a tribal community of practice around 21C efforts as well. So I mentioned our little steering committee. That's also helped to develop a charter and milestones that is a living document to help guide our work through the coming years. This is something that we are anticipating being a very long-term and sustaining process and project. And this might be the first time you're hearing about it. This definitely won't be the last time you're hearing about it. Next slide, please, Megan. So this slide here is sort of what came out of that, charter and that all of that work that happened sort of through the winter and spring, and acknowledging that this effort really is with all of our partners who are on board with this. We want a shared message and we want to be really consistent with how we're talking about 21C. And so our partners have worked hard to establish this shared understanding of the 21C effort to ensure that a mission, vision, and values are in alignment with the work being done. We envision as 21C a strong and agile public health system at all levels. Our mission is to foster trust and collaboration across Montana's public health system to enhance the delivery of those foundational public health services that promote health and well-being. And our values are really, I think, embody the fact that we do envision this as a shared responsibility for everybody, just to have that continued alignment with these efforts. So hopefully that gives you some background and a little bit of understanding about how we got here and sort of what is 21C, just to sort of lead us off there. And I'm going to pass it over to Megan now to talk about some data.
Thanks, Sarah. You know, I think the other thing I'll mention in relation to 21C is it's really an initiative not only at the local and tribal level, but also for all those logos that you saw, for our system to come together and be a unified front instead of different organizations doing different things. And so making sure that our resources are aligned in supporting local and tribal jurisdictions, that our messaging is aligned. And how do we do that? Well, we need to use the data to start with. We're good public health professionals. We love data. And so that's going to be kind of the core for how we understand where we're at. And then where we want to be is really through conversations that are beginning to occur right now, and we hope continue to occur into the future. So with the data, I want to point out that the state health assessment and state health improvement plan are officially live as of, I believe this morning. Those are both on the A Healthier Montana webpage, and we'll put a link to that into the chat. But both of those are finally available, and we're excited to share that with you. In addition, today we're really going to focus on the Foundational Public Health Services assessment that was completed last year. To many of you, it was the 134 question survey. And so we're going to dive into those results now. So what are the Foundational Public Health Services? This is a framework that was developed by the Public Health Accreditation Board, or FAB, and it outlines basically the services that no jurisdiction should go without in terms of governmental public health. And so there are the foundational areas, foundational capabilities, and then this health for all that surrounds it. And so this framework not only is the basis for accreditation and pathways to recognition, but it was also the basis of our survey. And I know we've received many questions. Why did you choose the Foundational Public Health Services framework? The reason behind it is really because it's used for that national effort for accreditation, pathways to recognition. There is significant alignment with the 10 essential public health services. So all of these frameworks are very much aligned, and we have never had this data before in Montana in terms of understanding how these services are being delivered currently. So how we went about this process is we looked at assessments that were done in other 21C states. So every assessment that was completed, we looked at it. We went through their questionnaires, their methodology, and decided that we were going to use their questions, but make it Montana specific. So what we did is we pulled all the questions together from all the assessments. We did through which questions were similar, and then that kind of gave us our core question set. At that time, we then made every question Montana specific and had a 1 to 4 point Likert scale in which jurisdictions would self-rate themselves. And I'll get into that in the next slide. And that was completed between January and March of last year. And then beginning in April is when the logistics came about. And that was because we decided if we're going to do this, we're going to do it right. And we are going to hit the road and go out in person and meet folks where they're at. We know that going through 134 questions is exhausting and time consuming and maybe not fun. But the best way to do that is to really go in person and learn more about your health departments, what you are experiencing, than just those questions. So in total, we had 15 in-person regional meetings. And then for the jurisdictions that weren't able to attend those, we met virtually. And so that was completed between the very beginning of June to the very end of November of last year. So it took a little bit of time. But as Sarah mentioned, we then started work on 21C in December. So you can see that we're about at a year now, and we've made significant progress. And so it's a great example of if Montana sets its mind to something and we have all the partners at the table, we can do a lot very quickly. Beginning in March of this year is when we started the data analysis process, or excuse me, that started in January and finished in March. And so each jurisdiction will receive an individual copy of their assessment results. And then we'll have several statewide reports that will go out. The one statewide report that's completed currently is one geared towards local governing bodies, boards of health, and tribal councils. And if you're interested in that statewide report, please send me a message. So now we get to dive into the data, but before we do that, I just want to orient everyone to the Likert scale for each question. So 1 to 4, 1 is that a jurisdiction doesn't have it, maintain it, or complete it. And then a 4 is that you complete this routinely and or have a formal process, meaning written. And there were some questions that you would have that would be and or, and some would be and, so a routine and a written process. So here are the results. You can see at the very top here, in very small font, are the domain areas. And so these all relate back to the foundational public health services. Below that, there's the average score. The higher scores are on for me, they're on my left-hand side of the screen, and then the lowers are on the right. And then the bars below them are a percentage breakdown of jurisdictions statewide that scored 4, 3, 2, or 1. So we can see in terms of jurisdiction strengths, it's all things communicable disease. So not only what you do day in and out in MIDAS, disease investigation, contact tracing, it's also communicating with providers and partners on communicable disease rates, and then testing and diagnosis. Emergency preparedness also is a strength in the system, which shows that when you all are given dedicated funding, resources, expertise, that you can really take that and run and do an incredible job. We also have local governance, and I think this is one that we hear time and time again as something that surprised folks. And really what the questions were in this section were related to meeting statutory requirements. So I know at the state level, we're happy to hear that overall most boards of health are meeting statutory requirements. Now, on the other side, areas of opportunity, we have policy development. So this is an area that boards of health could play a bigger role in really understanding policy development, regulations at the local level, but then also being active at the state level. We have organizational competencies. These questions were geared towards workforce development plans, performance management, quality improvement, strategic planning. And then our lowest scoring domain is community health improvement plans. I will say there's a caveat with this one. Most jurisdictions at the time were completing their CHIP or in progress. And so we feel confident that that score will be bumping up very soon. Now, the other thing that this assessment collected was pre-work data. And so we asked questions on staff and budgetary information, and in particular, FTE or full-time equivalent employees. So this was the first time that we actually have a number in terms of how many people make up Montana's public health workforce. In addition, we have a range of FTEs based off of different jurisdiction sizes. We know that the AMPO classification or Association of Montana Public Health Officials breakdown may not be representative or what everyone likes to see for their jurisdiction, but that's the model that we went off of. So you can see that Montana is mostly frontier and small jurisdictions, 38. And then for each of those, you can see the range. So between all of them, there's quite a range in terms of number of FTEs that are providing all of those foundational public health services. So with that, I'll turn it back to Sarah, and she mentioned quite a bit of progress that's been made, but we're going to dive into a few areas in more detail.
Great, thanks, Megan. Next slide, please. Awesome. So yeah, there's, like I mentioned, there's a lot of work that is being done in a lot of different areas, but I did want to highlight a couple of accomplishments just to show that, as Megan mentioned, we've done a lot in the past year. And I think that one of the things that public health can just not always do better, but I think it's important to celebrate our successes. And I think that this 21C effort really gives us the opportunity to highlight what's going well and you know, to help continue that momentum in understanding that this is, you know, some pretty long-term lofty goals when we're thinking about how we're going to, you know, secure more funding for public health from the state level. That's a pretty long-term goal, and we really want to be able to focus on also highlighting what are some things that we can you know, really celebrate in the interim as well. So the communications piece, I mentioned that work group or subgroup that was formed after that December meeting really has helped us be able to message what is 21C. We have a website now. We have this cool logo that you see in the corner. You know, branding is really important to be able to highlight, like, you know, when you see an image, when you know, hear about 21C, have a common understanding about what it is that we're talking about. And has really also helped with some talking points and some clear language, so that, again, when whichever partner you're hearing about this from, hopefully it is a consistent message across the board. Megan really highlighted the data analysis piece. There's so much work that went into that. I attended some of those meetings, but I was not intimately involved in that data the way that Megan was, and a lot of folks who really helped I think develop it into a report that is both useful, as well as, if you know, what we have heard this week is that it is easy to understand, which is no small feat when it comes to pulling together all of those different pieces and parts and information. So if you haven't seen those reports, please reach out to Megan and she can get you that state report. Really want to share that with as many people as we can, to be able to highlight the great work that we did with that. And I think it also is a testament to, you know, making sure that we're also giving back to, you know, ensuring that the people who were kind enough to engage with us and respond to those surveys and to give us that data also have it, you know, have it in their hands and can use it for their own purposes as well. This isn't something that we want to hold, you know, for 21C purposes, but also this data can be useful for, you know, having conversations with commissioners and boards of health and policymakers and decision makers in communities that these, you know, foundational public health services are impacting as well. I mentioned the Confluence Conference. Again, if you were there, hopefully you saw that the keynote speech, or it really was addressed. It was a collaborative effort by multiple people to share the excitement and hopefully provide some energy around the 21C initiative. Just laying that foundation and being vocal about this is, you know, who we are, and this is the convening and the collaborative efforts, and really showing up for that. So that was, I think, a really cool thing. There is a recording somewhere. Megan, do you know where that's located, or where people can access that?
Yes, I can put the link in the chat. It's available via Train Montana. And I know one great thing that we've heard this week is that everything needs to be located in one spot. And so I promise, I know I see a couple of you that have attended the in-person meetings on this call, and we're going to dive into that once we get back to our normal jobs and get everything in one location so it's easy to access.
Yeah. Yeah, and to that point, I think one of the benefits of this process as well is that alignment piece. You know, we are there's a lot that's being asked of local and tribal jurisdictions in terms of assessment and being able to really help inform these efforts and what we're hoping to accomplish as far as 21C goes. We want to make sure that we're not being redundant with those questions, that we're not, asking the same information more than once. And so that I think is another huge benefit of this alignment and this collaborative and the 21C effort is that hopefully we'll be doing less of that because making sure that all of our partners are on board and that we're engaging with partners, that if there's something happening over here, we can maybe collect that information as well so that we don't have to duplicate efforts that way, which is pretty cool. I'm going to talk about the tribal FPHS and community practice in a little bit, but also the last bullet point here is the milestones in the charter. We do have a timeline and some milestones that really go through, I think, the next 8 years is what we're currently envisioning for 21C efforts. If we can do what we want to faster, that's great, but we really see this as a very, like a sustaining effort. And I was going to say something else about something else. Oh, our current, our shorter term initiative right now, there's a lot going on. There's 4 buckets really focusing on systems and alignment right now. And I've spoken to that a little bit, how we're really trying to get everybody on the same page. And so I think that, we can actually see some progress in that area as well already, which is pretty cool. You can pop to the next slide, Megan. Great. So wanted to highlight a couple of activities just to give you some more context on things that we're working on currently and how you can be engaged and involved. The first one is the workforce assessment. Montana has conducted 2 previous public health workforce assessments in 2019 and 2022, and a statewide workforce development plan was developed after each one of those. These assessments and the following workforce development plan are used to inform trainings and activities in collaboration with a lot of system partners, notably the Montana Public Health Training Center, who is hosting this webinar today. Confluence Public Health Conference, I think identifies public workforce training needs to address those at the spring conference, and so many DPHHS efforts, notably the Summer Institute, sponsoring continuing education, and then sort of facilitating and coordinating other trainings and professional development opportunities. Some health departments may also be using this workforce data for accreditation purposes. So this workforce assessment is, I think, a really great example of that alignment piece and how we can all, use an assessment and some data to inform a lot of different efforts. There was an opportunity this year to align this next workforce assessment effort, the workforce assessment efforts with 21C, and that group voted to sort of come under the umbrella of 21C as well for all of the reasons that I've previously mentioned. And so this year there's going to be a 2-pronged approach to that effort. The first is an individual level survey, which is what has been done in previous assessments, getting individual level surveys out to all public health staff and workforce across the state at local, tribal, and state levels. Captures demographic information as well as public health workers' perspectives on key issues such as workforce engagement, morale, training needs, and other emerging concepts in public health. What's new this year is what we are calling the workforce census. Megan mentioned that we did capture some of that FTE data during last year's Foundational Public Health Services assessment, and this census tool is going to be building on that. So the idea is that each jurisdiction will get an Excel spreadsheet with that pre-populated data from those from the assessments last year and that pre-work so that you don't have to start from scratch. Again, we're trying not to ask the same questions twice. We're trying to build upon the information that we already have. And the hope is that this data will not only give us the first really, really complete census of the public health workforce, but allow us to educate and further policy conversations on funding for public health services, specifically as it relates to workforce and what that could look like. We're currently finalizing this tool and anticipate that assessment work happening this summer and wrapping that up at the end of the summer. I believe the plan is for the next workforce development plan to launch in January of 2026. So next slide, Megan. So the other thing that I am excited about, another activity that we're currently engaged in, is working on convening a tribal public health community of practice. So each tribal jurisdiction, as Megan mentioned, participated in those foundational public health services assessment last year, and we understand that tribal public health looks different from local or county public health, not only from like local to tribal, but also from tribal jurisdiction to tribal jurisdiction based on how these agencies are structured and organized and a lot of different factors there. So 21C is seeking to engage with and involve the American Indian tribes and tribal public health professionals to help design and lead this community of practice. And this requires acknowledgement of the sovereignty of Montana's tribal nations and recognition that tribal people are the leaders in any work to improve their health and quality of life. So really what we are envisioning as the 21C partners is to provide that space and to be that convening body, but those efforts and those conversations to be tribally led. So there are really two main goals for that community of practice, which are on the screen there in really small font, so I apologize for that. The first is to provide a structured space for tribal public health professionals to promote peer learning, collaboration, and shared successes and best practices to support public health initiatives and outcomes for their populations and their communities. And the second is to serve as an advisory body to plan and pursue those 21C connected efforts to continue to assess, understand, support efforts to strengthen the foundational public health services in tribal communities in Indian country. So to date, we've convened a small group that includes the Institute, DPHHS, the Office of American Indian Health, and then three representatives from three different tribal communities. And we're currently drafting one-pagers and a draft resolution so that we can have those conversations and approval from tribal councils, from a government to government relationship, and then also identify the people who are actually going to be, who are doing the work, boots on the ground, those public health professionals who can actually participate in those conversations and share that information. So understanding that, this is, and I think a good example of how 21C also ties back to that national effort on 21C. There's been a couple of other states who have, I think, done a really excellent job in engaging with their tribal partners and their tribal communities. And so, that I think also, like I mentioned, ties back to the fact that, while we're looking for Montana solutions to Montana problems, we have a lot of resources and experts who have done this work previously that we can, pick their brains and so we're not starting from scratch either. I think that is all I have on that. I'll pass it back to Megan.
Thanks, Sarah. So I want to just pause here before we get into next steps and see if folks have any questions at this point. If not, there will be an opportunity at the end. I think in terms of next steps, it's really, I know that this can be a pretty difficult time in terms of uncertainties at the federal level in terms of funding, but I think 21C really offers an opportunity to think about these problems in a new way and to tackle them head on. With this 21C, Montana 21C is not owned by a single organization. It's shared responsibility across all those organizations that you saw on Sarah's 21C partner slide. So it's not driven by DPHHS, it's not driven by the Institute or any of the partners you saw on the screen. It's shared responsibility, and really it is led by local and tribal voices. And so part of that is been going out on the road and understanding what folks need and want for the future of public health in Montana. And so this has been an opportunity for us to provide all local and tribal jurisdictions with their data. So again, all 60 local and tribal jurisdictions completed the foundational public health services assessment. So we've been able to provide with their data and have some really engaging conversations on what folks need, what they want in terms of how our system can be better, and envisioning that next step for public health in Montana. Sarah's mentioned the workforce assessment. I know this probably feels like yet another assessment that you have to do. And I promise there's this larger goal in mind, which I'll get into here in a minute. But we hope that with that workforce assessment that we'll have the same 100% completion from all jurisdictions, because that will really strengthen the case as Montana 21C looks towards policy and funding solutions. One of the big things that you all can do is to think about a lot of these issues that have been brought up in today's conversation that will be discussed in the 21C regional meetings. And that is, what can public health in Montana look like? Not just in your jurisdiction or your neighboring jurisdictions, but across the state. What do you want it to look like? And having those conversations with your teams, with your community stakeholders, with your boards of health, your tribal councils, your commissioners. I think the other thing here is that your state partners want to serve you in the best way possible. So if there are things that you would like change or that aren't working, please reach out to those officials. I think the big thing with this is we got a lot of great feedback when we did the assessment in terms of how things can be improved. And we want to make sure that that feedback is more on a continual basis than when we do a tour across the state every couple years for the assessment. One thing I'll also note is I know it's budget time of year, and we are hoping to have regular regional meetings for Montana 21C. And so next year we'll hope to have at least 1 to 2. So that's another consideration. But in terms of the long-term goals of Montana 21C and the process that we're following, is it really gets into this assessment piece. We have to know where we're at, where resources are needed, what do we have in terms of our public health workforce, what is our cost analysis based off of each jurisdiction's budget in order for us to really identify our system strengths and gaps. We know that it's more than funding. Funding is not enough. And so with this process, it's about building capacity and also skill set. And so that's why the training center is a huge partner in this. In addition, it's doing the policy and funding efforts. So once we get this assessment piece done, we're really going to work across our system and understanding gaps, areas of strength. And then one question for you all to think about is that foundational public health services model from FAB. We want to have conversations on, does this model work for Montana? Is it really possible for one FTE to be expected to deliver this? What are your thoughts? What do you want this to look like? What are the core capabilities that every health department in Montana should be providing? Other states have tailored that to be their own. And so we want to know, does Montana want to do that? And if that's the case, we want it to be led by local and tribal voices and not by any of the state level partners. So the long-term goal of this is updating policy at the legislative level in terms of either code, administrative rules. In addition, seeking sustainable state funding from Montana, so less reliance on the federal government. In addition, like I said, funding is not enough. And so really increasing capacity at the local and tribal level through workforce development, through alignment across system partners, so you can be more efficient in your jobs. And then once we go through all of this, like Sarah said, it could be an 8-year process. That's the timeline we have set forth at this point. We're hoping that there is going to be some small windows of opportunity to really speed this up. But to be honest, a lot of this is up to participation from all of you, buy-in, and then really getting a sense from our legislatures where they're at and what is their support of public health and some of these more cross-cutting ideas. So with that being said, how can you join Montana 21C efforts? I'll turn it back to Sarah.
Great. Well, the good news is that, Confluence is one of our partners, as is INFO and MPHA and MIHA. So if you are a member of any one of those organizations, you are also a member of 21C, which is great. And we also, as I mentioned, with our branding efforts, Megan, if you could advance the slide, we have a website and we have an email address. So you can visit the website. We are obviously hoping to keep that updated with resources and news that's newsworthy stuff that's happening with 21C. Because this is a collaborative effort, we are not going to put another newsletter or ask you to sign up for another newsletter to get in your inbox. We are asking all of our partners to include 21C related information in their respective newsletter so that we can continue with that shared messaging and align those efforts without adding another thing on somebody's to-do list, which is to monitor a social media page or create content, but really spreading that out across the partners. That email address, info@montanapublichealth21c.org, is also, we have shared access to that. There's a real person behind that. Megan has access to it. I think I have access to it. Definitely Hillary Hansen does. But we, those are real people behind that info at domain. And so please reach out to us with any questions. We have this website here because we want to, again, have a consolidated and consistent approach to this. So instead of being like, well, who do I ask about 21C? I have questions about 21C. Which one of the partners should I ask about it? Send an email to this address and we will, make sure that it gets to the right person. We can answer it on behalf of 21C. Want to direct you to that webpage and that email address for 21C related content and questions, just again, to keep things consistent and clear about who we are and what we're doing. With that, I think the next slide is sort of wraps up our content for the day. I want to once again thank everybody for being here and for hearing about what we have to say about 21C. I'm thrilled and excited about it. I think this is a really incredible opportunity for Montana to really have an opportunity to do the work that we want to do to align those efforts. The main goal is to get secure additional funding specifically dedicated to public health and figure out what that looks like and what we're, how we can best do that. So, Megan, do you have any closing thoughts as well?
Yeah, I know that today's webinar really is on the future forecast. And so I would say the forecast for Montana's future is brighter than maybe it seems at today's moment. And I think that through 21C, you'll see over the next 4 years better alignment across system partners and taking steps to be prepared for the right opportunities, making the right moves at the right time in relation to policy and funding development. In addition, I think that the greatest thing you'll see is better engagement across system partners to really go out to the local and tribal level and hear your needs and make adjustments accordingly. So the future is looking bright from our standpoint, and we're ready to better serve all of you.
Thank you, Megan and Sarah. We'd love for you to come on camera and off mute and ask any questions that you may have.
I'll hop in with a quick question while folks are thinking. So thanks, Sarah and Megan, for this great presentation. And I know the training center is really eager to hear from folks about identified training needs as a result of all of these conversations. One thing I'm curious about at the national level is we will have the opportunity as a state to learn from others about what they're doing. But Megan or Sarah, can you share a little bit about maybe the opportunity that Montana can also share kind of the efforts that we're working on? And will that be an opportunity for us to also kind of show off our efforts in our Montana way?
Yeah, I love that question, Anna. I think that at Confluence Conference, I fully admitted that I can be a bit competitive. And so the fact that Montana is one of, I think, only a couple states that had 100% participation and completion in our foundational public health services assessment, I think says a lot. I believe that actions really do speak louder than words. And I think that that's something that Montana does really well. We do have the opportunity to show off to national partners. It's amazing for being one of the more recent states to really join these efforts. I think the thoughtfulness in our process is something that our national partners are taking note. We are not having this be led by one organization, and that's how it is in most states. And so by bringing together partners, we then are really showing that we can all play nice in the sandbox and really go further together. And so I think that Montana is right on the edge here to really be a leader in public health nationally. And it's exciting to be kind of on that cusp. And it's really up to all of us to take that next step. And so I'd say more to come, but I know we have lots of eyes on us at this point.
Yeah, and Megan, I'll also add to that. There are 21 states currently involved in the 21C initiative. Montana is definitely the smallest population state for, it's if you, we don't need to pull the map back up, but like it's, East Coast to West Coast, there's a lot of, big players as far as like population goes. And I think that, making sure that Montana, I think highlighting our successes, even with our modest population compared to other states, I think is also a really exciting thing to be able to share with folks and show that, we have the workforce and the skills and the expertise to be able to accomplish, anything that those larger states can as well, which is pretty cool.
Then in the chat here, I put the link to the Train Montana presentation that was at Confluence Conference. We also have a link in the chat to the Healthier Montana website that has the SHAW and the SHIP, and then the Montana 21C Public Health. That's the link to our website, and that is updated as frequently as we can, usually on a monthly basis. But I think that there will be more to come there. The other thing I'll mention is with these regional meetings, those are really informing the milestones. So I know Sarah talked about that we have those drafted. Those are not finalized. We're really taking everything that we are learning as we go across the state to really inform those and make them the best we can to fit all of your needs and expectations and desires. So that's why it's important to continue to have these conversations, because if you don't like the milestones we've set forth, then we really need to hear from you, as well as anyone else on your team or throughout your community.
Leaving space for people to jump right on in with their questions. Pointing fingers at Todd and Greg. We're sure you have questions.
I have a question. Just Megan or Sarah, just over the past year since the assessment's been done and then up to today, any just common questions or themes from health departments, local or tribal, that you guys wanted to hit on that, have been common things that have come up over, or confusion or any other things? And maybe you already hit on all those.
Yeah, that's a good question, Todd. I can jump in first and then Sarah. please jump in. In terms of things that folks have discussed so far in the regional meetings, we've heard a lot about inefficiencies and really cleaning those up, being a unified system. We've talked a lot about how regions can better support one another. I think one big thing to clarify in this effort is that we are not looking to have Montana go from a decentralized to centralized public health system. That is not even in our vocabulary nor our conversations, but we are having conversations on how regions can better support one another. The other misconception that we hear a lot is that this is being led by the state or by the institute. And I would say that at this point, Sarah and myself are really handling all the logistics. So if someone else wants to do that, be my guest. But we're happy to do that and really fill that need in the system. But we want this to be led by local and tribal voices. I think AMFO, MIHA, and PHA is a great way to do that. In addition, we've heard a lot about the perception of public health in Montana and how that can be improved. And so we've heard some interesting ideas and strategies, nothing concrete to share with you all at this time. But what's going to happen is once we finalize all these regional meetings, we'll update the milestones and we'll send out a message to everyone so you can see how your feedback directly impacted those and make additional comments. Sarah, anything to add?
Yeah, I mean, we're in the middle of our regional meetings right now, so there's a lot of really good conversations happening. And one piece that just comes to mind is, making sure that we have a strong and effective public health workforce. I was in a group yesterday that was really talking about, well, how do we, make sure that we're able to hire, competent public health staff. And one of the things that I really appreciate about public health is that I just feel like there's so many different routes to the public health workforce, which I think just brings in just a really diverse skill set. And when we're looking at small rural communities, we want to make sure that people are that we have to have the workforce there. And so it feels like when we're talking to communities, these are really specific individual sort of level, community level problems, and there also could potentially be some system solutions. So I think that when we're looking at this, the entire system and all of these processes is really, we want to hear what is happening and what the challenges are at the local level, because there are a lot of times where those system solutions can help with those as well. So I sort of want to make sure that make sure that we're making that tie-in as well, is that while it feels like there's a lot of sort of lofty conversations happening right now, I think that our hope and our plan is that those will have significant impacts to local communities as well.
Hey, Megan, can I add one more thing? I just can't help myself.
Please do. I think for everyone's awareness, Todd was a big part of this. Todd, just wait. Todd was the former PHSD division administrator, and he really gave us the green light to be able to do this. And so without his initial support and also driving many of the miles, we probably wouldn't have had the foundation today. So Todd, it is a big kudos to you and all of your work on that.
You're hard to hear, Megan, for some reason. Well, the only thing I would add, and I'm not with the division anymore, but the presentation was great, Sarah and Megan. But the one thing unique with Montana that I would just chime in is just the relationship between the partners and local and tribal health departments, and just that day-to-day working relationship. And I think I'm really happy you guys are out doing the road trips again and meeting with people face to face, because we did get a lot more feedback than we would have gotten if we did all this work via Zoom. But the other thing I just say to the health department folks here, county and tribal folks, the only way we collectively can make this public health system better is hearing from you guys, because you guys are the boots on the ground. And so I just say is, do not be shy. If you got ideas, you got challenges and issues, let the team at the partner team know, because that's the only way. If they don't hear your voice, then they don't know what the issues and challenges or the bright ideas are. So I would just do a plug for that for sure. That's all, Megan.
Todd.
Any other?
Yeah, and I'm gonna pop the email in the chat again. I don't think it's been there before. So if you have any questions, please reach out.
All right. Any last questions, comments? Stephanie, Kim, anyone?
No, thanks.
Come on, Stephanie. You always have a great comment.
Well, I just went to the regional
Oh,
meeting yesterday, so,
You're talked
I-
out. I get it.
well, yeah, I did think of 2 more IDs in the car, so I just gotta email those out, so.
Perfect.
Fantastic.
All right, anyone else? If not, thank you. We really appreciate your time, Megan and Sarah, and we realize, you know, you're a little discombobulated up there in Glasgow. Hope you packed a parka. And we really thank you for all of your efforts and all the logistical planning of all of this and making sure that we all get a voice in moving this forward. And we're really appreciative of that. Thank you.
Thank you. Hope
Thank
to see
you.
many of you in the upcoming meetings.